Good evening, everybody, and thank you for coming to this event that we have this evening. We wanted to try to disseminate as much information about the health and safety of our reopening of schools as we could. My name is Rob Graham. I happen to have the honor and privilege of being superintendent of this wonderful school community, and we're excited that you're here today. I thought I would start just by thanking these wonderful ladies over here who have joined us this evening. We have Dr. Bissell from the New River Valley Health Department. We have Dr. Mogan from New River Valley Pediatrics, and we have Dr. Stewart with New River Valley Health Associates all here. And they have all played an extremely important role in us developing our plans to make sure that our students, staff, and community members come back safely. So thank you all. Appreciate you being here under these circumstances. And the format this evening is just going to be, we sent out an email link to have our community send in questions that they were concerned about, and so I will ask those questions and one of the doctors will answer them. And then at the end, if there are other questions that you all have, we're here. We can try to answer them as much as possible. I'm going to start just real quick by letting you know some of the mitigation strategies that we have in place, or that we've tried to put in place or putting in place still. PPE equipment is very hard to come by right now, so we're hoping that we do have a ton of stuff already and are hoping to have even more. So the first thing is every student and teacher will get a Bobcat bag, and in that Bobcat bag will be hand sanitizer. We'll have a bandana. It's a rocking R bandana that goes around their neck, and students can just pull it right up over their face. We also have 3 antimicrobial pencils, so they don't have to worry about if they drop their pencil or if their pencil accidentally gets shared, they can still use it. We have that too. We also have ordered big gallons of hand sanitizers to go in each of the classrooms. They're the foam sanitizers. You can get 800 pumps out of them per hand sanitizer. We've put in also touchless hand sanitizers throughout all of our buildings. They're on the walls. We have touchless water fountains, touchless towel dispensers that we have. We've purchased all these posters and decals and spots and things where people are to stand and travel down the hallways or in the cafeteria. All our buses have bus spots on them. That's a rocking R showing students where to sit. We've purchased sneeze guards. I don't know if I ever knew in superintendent school that I would have to purchase a sneeze guard, but we have sneeze guards for those folks, and we've sent them to the schools. We also are looking at 1,000 face shields for our community too. That'll be 500 adult and 500 children's, and those are face shields that have Bobcat Nation on the top and Rocking R at the bottom of them. So in addition to all those purchases too, we stay in close contact with Dr. Bissell. I've been fortunate enough to get her cell phone, and I text her almost every day or call. We also have David Ridpath, we have Chief Dodson, Chief Haywood on our safety committee, so we feel very fortunate that these folks have given us their time and helping us prepare as best as we can. And we start on Thursday with our Rocking R's coming, and then our Friday of the Bobcats. And those 2 days will be mostly an orientation day for our students face-to-face and virtually, really covering a lot of this stuff. We need to educate our students the best that we can. They need to be a part of that. We need you all to help us with that. We're really counting on our parents and community members to help us with that. That's why we have a family commitment document that we have every student and family sign. We really need your help with that. And the other thing that I forgot to mention too is your child will have a health screening every morning that they come to school. They'll be screened in 2 different locations here at the high school. They'll be screened in 1 location at the elementary school. The screening is simple. Kelly, it's 4 questions, right? I believe 4 questions on our health screening questionnaire, and then a temperature check. And our procedures for that now is if a child comes and they do answer yes to a particular question, or perhaps their fever is over 100.4, we are going to give them a chance to cool off, because we have buses coming. It's hot out here right now. We found out in the summertime when children get off the buses, their temperature is elevated, so we'll give them some time for that. even after we do a double check on that and maybe they still are showing some signs, then we send them to our wonderful school nurses. We have 4 of them now, and they will do a full evaluation. Will your child go home? It all depends upon what they see in their full evaluation. So if you get a temperature check at the door and it's 101 or something, we're not going to send them directly home. We're going to work with our nurses who are the professionals to see if we do need to send them home or not. So having said that, I'm going to just ask a few questions here. And I think I would start with one of the ones that I'm getting the most for you all doctors, and that is, are Radford City schools safe to reopen, even with the university coming back as early as, I think it was last week that they started. So I don't know who wants to answer that, but.
So I think the biggest thing to think about here is everything is about mitigation of risk. I mean, there's no 100% elimination of risk in anything. Radford's come up with a plan that addresses all of the guidelines that have been put out by the CDC and Virginia Department of Health for mitigation of risk, and they've actually gone above and beyond those guidelines. We know enough about this virus that basic infection control and prevention measures work really, really well. You know, at VDH, at the New River Health District, we've been dealing with this since April. We've investigated cases throughout the district, and by and large, this virus is transmitted by close contact without any kind of face coverings, close contact indoors. So with the measures that we're putting in place, with the physical distancing, I prefer to say physical distancing because we don't want people to be socially distant. We want them to stay socially interacting. But the physical distancing, washing hands, washing hands, washing hands, and the washing hands is much more important than a lot of the surface contamination stuff. Not touching the face, staying home when sick, and that's something that we really, really have to reinforce, is stay home when you're sick. You know, it used to be this badge of honor that you plow through it and you go to school or you go to work, and we can't do that right now. So covering the face, both the nose and the mouth when you can't adequately physically distance, and especially important indoors. So with all of those things in place, that mitigates risk significantly. And we have studies, we have stories from where there were COVID positive people. You may have seen the studies about COVID positive hairdressers who transmitted between themselves when they were not wearing masks in close contact. But then there were no secondary infections when they and their customers were wearing masks and had very close contact. So I do believe that the plan that Radford has put forth is very good at mitigating the risk. I think they have the contingencies in place. I think it's flexible, it's adaptable, and that's what we need during something like this. I know people are concerned about the university coming back. I will say that in March, after spring break, I'm not sure that people realize this, but we had a good number of students, both Radford students and Virginia Tech students, come back after spring break because they live off campus and they have an annual lease and they didn't go home. And things didn't explode here. You know, the students congregate with each other. Our important goal is to see where they intersect with our population. And we will follow that, and we are following that. But by and large, our college kids, they congregate with other college kids. So we are aware of the concern, but that risk is not a significant one in our eyes to really challenge reopening the schools. So it always starts with the case. People tend to want to jump to conclusions, but again, it always starts with the case, and we find out where they've had close contact. And close contact is not being in the same building, it's not even being in the same room necessarily. Close contact is being within 6 feet for more than 15 minutes, not wearing any kind of facial coverings or protection. So most of our cases that we find have less than 5 close contacts. So we take every case on a case-by-case basis. If a student tests positive or a teacher tests positive, we will interview all the appropriate folks, the teacher, the bus drivers, the administrative staff, the student, the family members, and we'll start there. We'll identify contacts and we'll go from there. But one case is definitely not a reason to shut a school down. We may end up having to dismiss a classroom. We may end up not having to. It's an individual case investigation that leads to the contact tracing, and then we go from there. Our goal is to keep schools open. Our goal is to keep the kids in school as safely as we can, and we'll take each one of those. We have augmented our staff significantly in anticipation of this. We have the case investigators, we have the contact tracers. I have a fabulous epidemiology staff that has been doing this all summer. We've gotten pretty good knack on where the shortfalls are, where we really need to be aware of things. So there is no threshold. I think that's another question. What would be your threshold for closing things down? What we look for is, connections, what we call epi-connections. So for instance, if you had multiple cases in one classroom, that's different than multiple cases in the school. An individual case is not cause to be alarmed, but if you start having connections of those cases, that's when you then have to start looking and see where those connections are and how far out that spreads. But it always starts with the case, and there is no absolute to determine what the path is going to be. It's going to come from those case investigations and that contact tracing.
Okay, thank you. So another question that we've gotten a lot of, is it safe for children, middle and high school students to be in a room together without masks? And currently in our health plan, we have said that as long as you are 6 feet or more apart, the child or student can pull down their bandana or their mask as long as they're at that distance. But once that distance closes, they have to get that mask on immediately. And let me be real clear in this. Every child has to have a mask. If they are medically fragile, we aren't really taking any, we feel it's so important for us to have masks on that if a child can't wear a mask, we're going to ask them to go virtually. And probably if they can't wear a mask for medical reasons, they probably don't need to be coming face to face either. So every child will have to have a mask within 6 feet of another child. So what we feel like that'll be is mostly when they are sitting in their classroom, because they'll be distance away from themselves. There'll be distance, I would say, when they go outside in their recess, they could potentially pull down their mask there. Anytime that they're standing and moving, they're going to have their mask up. And our teachers know this, and they're going to make sure that they're educated on this as well. So I guess the question is for one of you all. I see like city council meeting where everyone is seated 6 feet apart, but we're still wearing masks because they are congregated inside. I know that the close contact is 15 minutes with no mask, closer than 6 feet. Thinking about past outbreaks, it seems like an hour in room with no mask, especially with an unmasked teacher speaking loudly, would be a risk. Do you all see any risk of us continuing with the procedures that we have in place when our children are within 6 feet to have that mask on, and when they are not within 6 feet to go ahead and pull that down as long as we teach them to do that? Who would like that one? Florence?
So, we definitely know that masking helps. Both the CDC and VDH guidelines do stop short when physical distancing can be maintained of mandating masks. They encourage them. They want kids to get used to wearing them. And I think the biggest thing with masking is the mandate versus the choice is that we need to encourage our kids that this is kind of part of things and to wear them when they can. And definitely when they are closer than 6 feet separation. Now, in the classroom, there are other considerations. Yes, it is indoors, so if everybody can develop that culture of taking care of each other and wearing masks, I think that really is a fabulous thing. What we don't want to do is get into this that you can't take it down at all. Because if you have kids come into school and being expected to wear masks all day, every day, we'll lose them and we'll lose that compliance. Now, the way most classrooms are being set up, you're going to have the physical distancing. You're also going to have them facing all of them are facing front, so they're going to face someone else's back. So it's not like they're face to face. And that's what you're looking for, is if there is, somebody who's talking loudly, or that cough or the sneeze that projects those droplets. So there are a lot of mitigation strategies that they can use in the classroom. We do encourage it. We absolutely do encourage it. And it really has to be about that sense of community in the classroom and taking care of each other, taking care of the teacher, taking care of my classmates. And I think we can do that. And I think that's part of that relationship that the teacher and the students have to develop. And they have to look at it as not so much a mandate, but this is something I want to do, to take care of my fellow classmates and to take care of my teacher. As far as the CDC and the VDH guidelines, though, they do stop short of mandating it if you can maintain that physical distancing. And if you can have students kind of facing the other one's back and stuff. So again, it's all about mitigation. It's not 100% elimination. And the bottom line is we want to create that culture in the classroom of taking care of each other and doing everything we can. We don't want to blame. We don't want to shame. We don't want to get into these battles about, you have to wear that mask the entire time you're in the building, because then we're going to lose it. So we've got to find a balance in everything we do. And I'm hopeful that getting the kids back with their teachers, getting them back with their classmates, we can appeal to that sense of taking care of each other, and it'll just become a natural thing. To be honest, I hope this goes even beyond COVID, because I think it can help us with a lot of communicable diseases that we can really prevent the spread in our schools that we sort of got really lax on in the past.
So here's a question as to why are we in such a hurry to start face-to-face classes when other districts are delaying their start in order to give their teachers time to learn how to teach virtually, as well as to see what happens with our new numbers in the next few weeks. And the next question with that is, why are we starting schools before we have enough information on what the COVID numbers will look like after RU students return? I can tell you right now that we would not return right now face-to-face if we didn't have the blessing of the New Valley Health District or Dr. Mogan or Dr. Stewart or our safety committee. I will also let you know that it is imperative for our children to get back in school as quickly as they can. There is a risk for us to be back in school, back face-to-face, but there is even a greater risk for us to not do that. And we have children out there, we have parents out there that are counting on us to get our children back into school, and we provided a virtual option so those who feel like that it's not safe for their child to go back to school, that they can still be with us in Radford City, either through Virtual Radford or through a program called Virtual Virginia at the secondary level. So we've kept in close contact and talk weekly about, is it still okay to go back? And the answer is absolutely yes right now. That may change tomorrow. But right now, we are scheduled to start August 14th. We are looking forward to having our children back in our schools. It's been August 13th. Oh, my Lord. Thursday, August 13th. Sorry about that. Thursday, August 13th is the first day for our Rocking R's. So we're looking forward to having the children back. It will be face-to-face. It will be a very normal day. They will have specials. They will, be transitioning from class to class at the secondary level. We want it to make it as normal a process for our students as we can. We've been just thrilled at the amount of work that our staff has put into this. As far as training goes, we had our training this past spring. When we were forced to shut down, we had to train really quickly and get platforms up. So we've also just extended that during our pre-service weeks. We pushed back the calendar about 4 or 5 days in order to provide some more opportunities to get some training. That's going on right now. I know it's going really, really well. We feel very confident that our teachers are going to excel not only in the face-to-face interaction with our students, but also in the virtual interactions with our students too. So I would ask you to please be patient as this is a new process for us and we're learning. You all are going to learn. We're all going to need to learn together, and we're going to need to stay united in order to make this work. So for classrooms with inadequate ventilation due to the mechanical functionality issues identified in the email that I recently sent out, how have you advised RCPS to ensure that altered flow patterns will not place students downstream from one another? And I think Dr. Bissell answered that, because we're going to have students, they're facing each other's backs, so they're not facing each other's mouths. And the issues are here at the high school and middle school. And so we've opened up all the windows, all the classroom windows and doors.
We don't have control over cases that are testing that might have been done at the hospital. A lot of our outpatient practices are testing now. CVS is testing now, MedExpress, Velocity Care. There's other testing that happens, and we don't automatically get notified of that when it's done. So what we're relying on is the people who ordered the test and the labs that do the test to report them to us. Unfortunately, there are lab delays, and there are things that can create some glitches in the system. So the first person that finds out about it, that communication goes back and forth. If someone's tested through the health department, we would know about it. We actually, I know there is a question about Fralin, our lab that we're using in the New River Health District. I will tell you that that is probably the most sensitive lab that's running tests in this area. Their sensitivity, which means, the risk of giving us a false negative. The risk of a false negative is less than 5% with Fralin. That's much better than any other lab that's running tests in this community. So I feel very comfortable with our testing capacity right now. We have built that capacity over the summer in anticipation of our schools going back, in anticipation of our college kids coming back. And we have fabulous turnaround time. I know you hear all the nightmares about turnaround time being as much as 2 weeks and how that doesn't help. We pretty much get about 36-hour turnaround time with our labs. So we really are starting that case investigation the very next day. We work 7 days a week. So we make that contact as soon as we get that case. As soon as we get that lab report, we start making that case and doing that investigation. So I feel very comfortable with our lab, with how reliable our lab is, with how our turnaround is, because that's the key thing to mitigating the spread, is to have that turnaround time and to have your staff on those cases. And I feel very comfortable where we are right now.
So the last question I have is in regards to student teachers and interns and what our procedures are for that. And we are going to allow, that is a very, very important part of the pre-teaching process. And we are going to allow that. We've been in touch with both Virginia Tech and Raffle University. We originally had decided that we wanted to have, or I think the original decision was to have those folks tested, but we feel differently now, and we want to have them at least quarantined. So we're asking them to, while they're here, to be quarantined, and then they can come into our into the school system once that quarantine has expired. So yes, we will be allowing interns. That we get them from RU, we get them from Virginia Tech, ODU. So that is the partnership that we have developed through our clinical faculty program with the with our interns there. Did I miss anything on that? So just remember that a negative test is one point in time, right? So this broad testing that we get of all these students, it's one point in time, and it actually, if someone was exposed last night and they get a negative test today, they could be positive tomorrow. So testing is important, but it's not the end-all be-all. There's a lot of other things that go into play, and when you have your student teachers, you hold them to the same standards as your students and your regular teachers, asking them to quarantine for the 14 days, and then follow all the same precautions is much more important than that testing in advance. And what we find with broad-scale testing is that our positivity rates, and just in general, we've done pretty widespread community testing ever since we started testing, and then as universities across the state, across our region are testing, the positivity rates in just broad testing are very, very low, in the order of 1% to 2%. So it doesn't give you a whole lot. And we have to be really careful with broad testing. We don't want to overburden. Number one, resources are not limitless, so we want to make sure we're using the best resource,
taken the best advantage of our resources, and that's the physical resources themselves, the swabs, the tubes, the viral transport media. It's the human resources of the people to run those tests, and it's the lab resources of the capacity to run those tests. And if we do too much testing that's not necessary testing, that doesn't help in the public health prevention strategy, we actually bog down the public health investigations. And that's what you're hearing about on the news right now, is that they're doing all this testing, and then our lab turnaround times are going way up. And we've been very fortunate to maintain that, and that's our goal, to maintain that in our district. So we want to be very careful about unnecessary testing. It doesn't give us a whole lot, and it doesn't help the public health investigation.
Yes. Yes. Thank you. So just to you folks that are on live feed, I know you probably couldn't hear Ms. Denny, but she just clarified that our student teachers and interns will quarantine. They were brought in 2 weeks early to quarantine, so they will hopefully be ready to start with us once that quarantine has ended. So appreciate that. Just a couple more mitigation strategies that I just remembered. We do have isolation rooms, and I would love to give a shout out to Tammy and Kelly, our school nurse, and Heather Geralds, who they're in the direct line of duty, so to speak, and have been wonderful helping us put in these strategies that we're doing. We also have 2 new nurses that'll be up at the high school, Jordan and Melody, and we look forward to working with them too. But these folks are going to be in the, they're going to be the ones that are dealing with children who have symptoms, dealing with those isolation rooms, those types of things, and not one of them have complained about anything. So I think they deserve a little bit of a round of applause for that. Thank you all. And that's about all we have as far as the questions that we received from the community through our link that we sent out. Does anybody have anything else that we could possibly answer? Yes, sir. Absolutely. Yep. Yeah, that'd be great. Sure. Yes, sir. Yes, sir. Correct. Yes. I think that's a good question. So the question is, what would fans help? And make sure I get this correct now. Would fans help with ventilating our schools? And you know, we battled back and forth with the fans, and thought maybe we get some big fans and point them outside like you to draw the air out. And so we've definitely thought about that and are looking into that. I can't talk to you. I don't have the medical experience to talk about how a fan would affect a virus being blown around in a classroom. I don't know, Dr. Bissell, do you have any suggestions?
So obviously, yes, fans can help with circulation, but there are also, you know, you get the fans actually can propagate the viral particles, and that's what happened with that one study that was from the restaurant in Japan or China, where there was a unit on a wall that was blowing air and right, sucking out definitely helps. Yeah, sucking out definitely helps. Keeping the door and the windows open and that natural ventilation will help as well. Right, that's something that can help for sure.
So you would be suggesting that we order fans for the classrooms to be placed in the windows blowing out? Okay. No, I think that's a great suggestion. No, I appreciate it. Sure. Yeah. No, that's a good suggestion.
And you will get a lot of, if you have the door open and the windows, you'll get a lot of natural ventilation.
Yeah.
Right.
And just so you know, we're trying to repair that ventilation at the high school as quickly as we can. It would. No, no, I appreciate that. Okay. Dr. Mogan.
Thank you, Rob. I was just going to address, there was a question about young children and spreading the virus. And I just wanted to point out there were lots of daycares that stayed open throughout the spring and the summer. And fortunately, we saw very few cases amongst children, no cases amongst children that I'm aware of in the New River Valley, and no cases in parents. So although children can contract the virus and can definitely spread the virus, the risk seems to be very low as long as children are cohorted, which is what the daycares were doing, and which is what essentially Radford City Schools are going to do by having small classroom numbers and children being basically contained with their teacher in their classroom, especially in younger kids. There was also a question about children and more serious complications of the COVID virus. And there are reports in the literature and in, say, in New York and Florida, particularly of a multi-system inflammatory syndrome in children, which I'm sure many of you have read about. No one really knows how extensive that is. That is a process or a disease state that follows COVID or COVID positivity, and it results in basically multi-system, kidneys, heart, lung, skin manifestations that follows a COVID infection, and it can be very serious, but the numbers are very low. And there were cases in New York during the time of the initial reporting of, in the spring, of all the cases in New York, but those have kind of waned, and there have been very few reports since March and April, and a few cases in Florida. So certainly that's something that we have to be aware of, and as pediatricians we are very aware of, but it's not something that seems to be a problem that would stop schools from opening. It's not. It's a serious problem, but something that is manageable.
Stuart, do you have anything you want to add? Okay, please do.
Hello. All of the questions pretty much have been answered, but I wanted to speak to you all as a parent. I am a physician, but I have 2 children in the system, and I feel one important aspect that we need to speak about is the mental health of our children coming back to school. It's very important. As we all know, children adapt and they hear more. So even if we're on the phone speaking to a loved one, I don't know why they're opening schools and various things like that, and they pick that up, and that could aid to their anxiety. Now, as a parent, if you have true concerns, then that discussion, I feel, if it's able to happen between you and your child in a positive light, say, look, schools are opening, but these are my concerns, in a way that they're going to be able to process it. I think if we unintentionally cause havoc or anxiety within our children, when they come back to school, they're going to have to try to figure out how to process that, and how to learn, how to also relate to their other classmates, how to relate to their teachers, and how to relate to anyone who is giving them instruction. So I just want to urge, as a parent, we just have to make sure in how we communicate, don't falsify anything. If you have a true belief, say something about it, but let's try to communicate with our children in a light that is going to allow them to be effective. Thank you.
And before I forget, just let me, food has been a question. How are we going to run our food? And again, those folks that are face-to-face will go to the cafeteria, get their meals, and then they'll go back to their classrooms to eat. We're not allowed to eat in the cafeteria. We just can't maintain our physical distancing like we would like. For those students that are completely virtual Radford, we will have our cafeterias, school nutrition folks will be ready for them from 9:30 to 10:30, and they can come in at Goldsmith Circle, which is right up here, for secondary, and to the front of the cafeteria at Bell Heath, and they can pick up all 5 of their breakfasts and lunches then. On Monday, yes, every Monday. So you'll have five breakfasts and lunches that they'll be picking up there. For our children that are rocking R's, of course, they'll get their meals, their breakfast and lunch at school on Monday and Thursday, and then in the afternoons, they'll pick up their meals for Tuesday and Wednesday and take those home. And then if you're a Bobcat, you will be fed Tuesday and Friday. On Tuesday afternoon, you'll pick up your breakfast and lunch for Wednesday and Thursday, and then on Friday, you'll pick up your breakfast and lunch for the following Monday. So that's our food distribution. Lots of thanks to Connie Wood, our school nutrition director. Ms. Rife is here. She's one of our board members, but she's also part of the Bobcat Backpack Program, and that's been very, very important for us this summer, and that will continue to happen. We will continue to, and in fact, they're providing pantries for snacks for our schools, so we appreciate that as well. So other questions? Yes, sir. Okay. So the question is, what as we move forward, what would the notification process be to alert school divisions around not just Radford City of the need to shut down? And so for us, and Dr. Bissell can certainly add to this, we will continue to keep in close contact with her, and if there's a determination from the health department and our safety committee there is a need for us to completely go virtual, then we will do that, and the notification will come out through power announcement, through social media, through our websites. It could even be phone calls that need to be made, things of that nature, to make sure that everybody knows when that would happen. Now, we've discussed the possibility of having, you may have some cases at Bell Heath, and Bell Heath may need to shut down, but not the middle and high school. But yes, absolutely. Yeah, so let's take an example and say that we have a case that we know about, and let's say it comes from the health district first, because it's worked both ways. And we've had employees that have had it too. But if we get notified from them that we have a case, or we suspect we have a case, we will notify them. They will come in. They won't come in. They will do the contact tracing. And then they will determine what we need to do for that student, the students in the classroom, the school, and our division. Does that help? There'll be a letter sent. We have letters. If you go on our Return to Learn website, you can see the letters that will go out if there is a COVID case in Radford City. If you go to the website and then you go to the reopening of schools, and you go to our videos and you click on the orientations and protocols and those types of things, there'll be letters on there that show what the communication that we'll be sending to our parents. Yes. And there won't be any names. There won't be names. It'll just be this is what we have right now.
Yeah, so if there is a case in a school, when there is a case in school, there will be a notification to, the Board of Education says they want everyone at the school notified. The health department policy is we disclose pretty much the minimum amount, and all of our disclosures are to protect public health. So if it doesn't change anything as far as our being able to protect public health, we are not going to disclose that. So if, when the notification comes out about a case, we won't disclose gender, we won't necessarily disclose faculty versus student, we won't disclose class or grade, because what will happen, and this is where, communicable disease, identification, case investigation, and contact tracing is not something new. We do this every day. We do this for all kinds of diseases. It's just gotten 24/7 attention from social media and the media. And so now all of a sudden everybody feels like they need to know. And we understand that there's a lot of uncertainty, and the media attention really, drives that up a little bit. But we do this every day. So people need to trust that we are going to notify the people who need to be notified. And what we end up finding is that people will kind of say, oh no, there's a case in the school, my child probably had contact and needs to be tested. But again, we need to know about that. Again, that's not very often the case. So we start with the case, we do that investigation, we will notify that there's a case in the school, and then we will notify people who we need to notify about risk of exposure and whether we recommend testing, whether we recommend quarantine. We're not going to test everybody. There's a lot of times where if we determine there's a close contact, it's quarantine recommendations. So there will be notifications, but people need to understand that to respect privacy and to respect and protect the investigation, we can't disclose everything. People tend to want their privacy protected until they feel that they need to know something about somebody else's privacy, right? And so it's a fine line, because when we do our investigations, and actually I think we've had very good success with people trusting us and opening up to us and disclosing things to us. If we compromise or jeopardize that by disclosing too much in an investigation, it ultimately really impairs our ability to do our job and do it well. People have this natural distrust, and they have suspicions, so we need to make sure that we protect them as best we can. We will disclose anything that is necessary to protect public health. And that's what people need to trust. And again, we do this every day. with all kinds of communicable diseases, some of which can actually be more threatening to children than what COVID is to a lot of children. And we do that every day. So you will be notified if your child has had an exposure that we need to address.
Any others? Ms. Lusher?
So the first thing is that the rising numbers is not unexpected. The second thing is cumulative, okay? So it's not that we're getting 50 cases a day in Radford. That's the cumulative number of cases that we've seen since whenever we started keeping track, March or April timeframe. People want to know, is it all the Radford students? I mean, I can tell you that it's everybody. It's community members, it's students, it's people, who have traveled, people who've had backyard barbecues. It is strict. This disease comes from close contact and social gatherings. So we had plenty of people who had their backyard barbecue for 4th of July, and they had way too many people, way too much contact, sharing drinks, sharing things, and we had positive cases from that. The other thing is, 50 seems like a lot because it's gone up, but when you're looking in terms of contacts and investigations and the entire population, it's not a huge number. And we take every single case and we investigate around that case. And remember, a lot of that is contact that they didn't even have here in Radford, right? People who've traveled or people who have been in contact with folks from other areas and then have tested positive. The way it is reported is by your address. So you could have gone someplace else and been in contact with someone and contracted COVID, and then you come back here. You didn't get it here in Radford. You got it someplace else, but it's going to be reported here because that's where your address is. The Radford University students, it will be reported here because it is their local address. We have made a very conscious effort with both of our universities and our community college that we are not going to separate numbers, because part of our campaign right now, and hopefully you're going to start seeing it on the Radford transit buses and you're going to see it in your schools, is be committed, be well. And that really is appealing to everyone to take care of each other. It's a commitment that I'm going to do what I need to do to protect myself and my family and to protect all of my neighbors, because we want to take the politics out of it. We want to take the mandates versus the individual rights out of it. We want to make this about that basic gesture of community. And I don't want that university versus community. I don't want that, because it is a community. And we want our students to feel welcome and part of the community, and we want to treat them that way, and we don't want to hold them to any different standard than we hold our community members. So yes, we're going to expect to see an increase in numbers, but I hate that they publish those numbers every single day. Don't follow those numbers. They're going to go up, they're going to go down. We can get clusters, and the other thing I'll tell you is if you see the numbers jump in one day by 8 or 10, in 9 times out of 10, it is not 8 or 10 new cases that day. Again, with lab reporting, there are delays. Sometimes it'll take us days to get lab reports from some of our commercial labs. So it's kind of a running tally, and unfortunately, it is a cumulative tally, so it has no place to go but up. And I would say just, again, we are following where those clusters are, how they are related, how they intersect in the community, and how they impact our healthcare resources. Those are the big things that we're following with this. And we have a pulse on that every single day.
Other questions? So the question is, what is going to be the standard if a student or staff member tests positive for COVID? And we have worked on this, and so if we get a confirmed case of a student or a staff member, we would notify each other, and then we would rely on the guidance of Dr. Bissell. And I want to say is it 14 days, right? Is that what is it 10? 10. So I'll let her answer for that part.
So for a positive case, somebody who tests positive with symptoms, it is 10 days of isolation from the onset of symptoms. So a lot of times it takes a couple of days to get the test back, so by the time you get everything done, you're looking at maybe a week or so more of isolation. And they can be released from isolation as long as they are symptomatically improving and they have not had a fever for 24 hours without using Motrin, Tylenol, those kinds of things. Somebody who is not symptomatic, what we do is 10 days from the date of that positive test, and then they can return. When this all first started, and I think people have to understand that we learn every day. So things change, recommendations change, guidance changes. We learn a lot, but what we found, the CDC has found, is that there is no viable virus shed after about 9 days, and that's where the 10 days comes from. But if you can think back to March, it seems like so long ago, but one of the recommendations to go back to school or go back to work was that you had to have 2 negative tests 24 hours apart. What we're finding, especially with the sensitivity of the tests that we have, is that people are testing positive for 7 and 8 weeks, and they're definitely not infectious that long. So we don't recommend testing to go back. We recommend using the clinical and that time frame because we do know that they don't shed viable virus any longer than 9 days afterwards. And so that's the recommendation. Somebody who is a close contact to a positive person, the recommendation is for 14 days of quarantine because we know that 99.9% of people who are going to get sick are going to get sick within 14 days. And I'll tell you, our experience here is that most of them are sick within 5 or 6 days. So 14 days I think is plenty to really make sure that we're not missing something there.
All the way up top. Did y'all have a question? Yes, ma'am.
Well, it really depends on the age of the child. I mean, masks are not recommended for children under 2. And as anybody who has a 3 or 4-year-old knows, it's going to be really hard to keep a mask on a 3 or 4-year-old consistently. So I think the goal for daycares would be to try to encourage masks, especially when they're playing closely, but to realize that that's not going to be a real likely thing to happen. But I think the key is good hand washing and small groups and social distancing as much as possible, knowing that 3 and 4-year-olds don't social distance well. But again, in these small groups of 5 or 6 kids that we have seen in daycares, there has been very little, if any, spread. Even when grandparents were positive, it's been very unusual for the children to be positive in the classroom or for them to share it with other kids in their classroom. So I think that's a very positive thing to know. It's just been a very unusual thing. Daycares have been very successful. Does that help?
Anybody else? Well, please join me in thanking these wonderful medical professionals for joining us this evening. Dr. Stewart, Dr. Bissell, Dr. Mogan, thank you so much for helping us get a plan that's going to be safe for our entire school community. We really appreciate everything that you all have done, and thank you all for coming. This is live feed, or will be posted, and you can watch it again if you need to, or if you know somebody who wanted to come and wasn't able to come. We'll have it up. Probably take us a day or so to get it up, but it'll be posted on our reopening of school site. So everybody have a wonderful evening. Again, thanks for coming.